Tracheostomy tube dislodgement is a medical emergency. Always keep your emergency pack near the patient. The emergency pack should contain an obturator, one ambu bag, a well-inflated face mask, one pack of gauze, which can be pre-prepared into 4 folds, one large-size micropore tape, and a 10 ml syringe. If tracheostomy tube drops off, stay calm and remember the racing steps. R for reinsert. Reinsert the tracheostomy tube as soon as possible if you are trained to do so. This helps to establish a secure airway and prevents the stoma hole from closing. Use a new tracheostomy tube if you have one on standby. If not, rinse the tube that has dropped out with cool, boiled water before reinsertion. If the patient is using a cuffed tube, deflate the balloon completely. Skip this step if the patient is using a cuffless tube. Remove inner cannula and insert obturator. Keep patient's neck slightly extended. Use 2 fingers to gently spread the skin and keep the stoma hole open. Use your dominant hand to hold the tube, with thumb keeping the obturator in place. With the tip of the tube facing down, insert it in a smooth curve motion. Remove the obturator immediately and insert the inner cannula. Secure the tube and inflate the balloon with 6 to 8 ml of air. Place your wrist near the tube to feel for exhaled air. If patient's breathing is weak or if no exhaled air is felt, connect the tube to the ventilator or ambu bag. Check for chest rise. If you are trained to use a stethoscope, you can listen for air entry with it. Remove the tracheostomy tube if you suspect that it is not in the correct position. A for airway clearance. If you manage to insert the tracheostomy tube, suction through the tube and ventilate as usual. If you did not insert tube, suction through the mouth and wipe the secretion outside the stoma. Monitor the patient's breathing, SpO2 and heart rate. If patient is breathing well with stable vital signs, do not cover stoma hole and call 995 for ambulance. C for cover stoma. If patient feels breathless or SpO2 is low, cover the stoma hole with a folded gauze. Ensure that all sides of the gauze are taped down to prevent air leakage. I for inflate lungs. After covering stoma hole, perform rescue breathing with ambu bag. Cover the nose and mouth with well-inflated face mask. Hold firmly to ensure a good seal using the CE method. Lift the chin and tilt the head slightly to allow easy air entry. Observe for chest rise and monitor the color of the patient's face, lips, and fingernails. N for notify ambulance. If you are alone, connect the face mask to the ventilator for assisted breathing, while you free up one hand to call for ambulance. Call 995 to report the emergency situation. State your address. Do not put down the phone until you are told to do so. G for good ventilation and vital signs. It is crucial to monitor vital signs continuously and maintain good ventilation. Start performing CPR if the patient's heart stops beating. Remember, always keep your emergency pack next to the patient and keep calm. For tracheostomy dislodgement, follow the racing steps. Only proceed to the next step if patient needs further support. If patient is breathing well with stable vital signs, monitor the patient closely and call the ambulance. Thank you for watching. For more information, contact HVRSS or speak to your doctor today.